Okay, thank you all very much for being here, and I want to thank all of the people from the unions who are with me as well. And thank Congressman Courtney for his excellent work in the House. Sherrod Brown of Ohio wanted to be here. He couldn't be here, but he is very supportive of the effort we're undertaking this morning. Look, this is not a complicated issue. Our healthcare system is disintegrating. We need real healthcare reform. The estimate is that over a 10-year period, that reform is going to cost something like $800 billion to $1 trillion. Where is the money going to come from? In the House, our colleagues there have done the right thing. And what they have said is that at a time when the middle class in this country is collapsing, when unemployment is horrendously high, we are not going to raise taxes on working people in order to pay for health care reform. And what they have said is, after years of Bush tax cuts for the richest people in this country, we're going to ask the wealthiest people to start paying a modest amount more so that we can bring tens and tens of millions of people into health insurance in this country. Poll after poll shows that the American people think it is right to ask the wealthiest people in this country to pay a little bit more. It is wrong to ask the middle class and working families to pay more in these difficult times. That's what this issue is about. House has done the right thing. Senate has done the wrong thing. I've got an amendment in to emulate what is taking place in the House, and we're going to fight as hard as we can to see that wins. Let me now introduce Congressman, thank you. Joe Courtney has done a great job in the House. I think he has secured close to 200 signatures on this proposal. Joe, why don't you say a few words?
Thank you, Senator. And I just want to salute your leadership to bring forward an issue which I think at the end of the day is always probably one of the most critical in any large effort, which is who pays and how do you finance this historic opportunity to address the great unmet social agenda of this country, namely health care reform. In the House, joined by 187 other colleagues in the House Democratic Caucus, we presented to Speaker Pelosi during the months of September, October, and November our point of view, which, as Senator Sanders said, is supported by the American people, namely that we should not tax health benefits, we should not tax the middle class to finance this effort. There, I think, is now a large and growing body of evidence that the proponents' claims that this is somehow going to result in bending the cost curve, that it's going to result in higher wages, is suspect at best. But there is no question that in terms of where the healthcare delivery system is, forcing people into high deductible coverage, degrading and diminishing their health benefits, which all sides agree would be the net effect of imposing a tax on health plans, is not going to improve the healthcare quality of the people of this country, and it's certainly just going to add an additional burden to the middle class who suffered terribly under the Bush administration. So we stand ready in the House, again, 187 colleagues in the Democratic Caucus, to work with Senator Sanders, and we look forward to a conference committee, which will happen, to get the right outcome at the end of the day. And thank you, Senator Sanders.
Thank you, Joe. All right, Larry Cohn is the president of the CWA, the Communications of Workers of America, and these guys have done a great job in this fight. Larry?
Thanks. Great to be here with Senator Sanders, also Senator Brown, who's not here, Representative Courtney, and you heard what he said. He got 187 of his colleagues to sign on to that letter to the Speaker. Also great to be here with the leadership of the AFL-CIO, the National Education Association, the Steelworkers, the Teamsters. We're a united front on this. This is very simple. You can't make those who pay more. We need to make those who don't pay. All the employers in this country who aren't paying for health care, who dumped their workers, who dumped the retirees in recent years, they have to pay. That's good policy. Bad policy is taxing those who pay. And it's already been said, we don't need to go over it and over it. You're going to hear from frontline workers and their stories in this fight. But here we are at an historic time, and we need to make history. not break the backs of 30 million Americans who will be affected by this tax if it goes through in the first 5 years. CWA will release a poll this afternoon in just a couple hours. John Anzalone did, over 2,000 Americans. And that poll will show that 70% of this country is against the excise tax. And those same 70% are for health care reform. But as Representative Courtney and Senator Sanders said, there's 5 other ways in the Senate and House bills to pay for health care in a fair way. There's only one way that's unfair, and that's this excise tax that will break the backs of the health care for 30 million Americans over the next 5 years. So it's great to be here with our allies and with these leaders from the Congress, and together we will win. Thank you.
Thank you, Larry. Arlene Holt-Baker is the Executive Vice President of the AFL-CIO. Arlene,
Thank you, and thank you, Senator Saunders, and thank you, Representative Courtney, for what you're doing. We are here to say today, health care reform, yes, but no taxation on the workers. We need health care reform now, but we cannot afford to tax workers. We are going to hear stories from workers today, most importantly, on the impact that this tax would have on them. Workers have already paid, if you will. They have had stagnant wages, and so that they could hold on to their tax, make sure they could hold on to their health care premiums. It's time now to make darn sure that workers and Americans get the health care they need, but without taxation. It's been said again and again by the American people, over 70% of them, that taxation of our benefits is the wrong way to go. It is not a win-win. It will be a lose-lose for Americans. So we stand here today to say, yes, we want health care reform. We want it now, but without taxation on the backs of the workers in this country. And now to hear from the workers, most importantly here today, I would like to introduce Jim Huber. Jim is a member of the United Steelworkers Local 9477 and is the health insurance counselor for a steel mill in Baltimore. He's given a proud 42 years of service and is a third-generation steel worker. Every day, he helps workers navigate their modest health care and retirement plans, and he knows there's nothing Cadillac about them. He knows that workers have fought hard for these benefits, and even after they have given them, they still have to fight to get what they deserve. Now we want to hear from Jim, and I'll tell you this. Jim stands here with 11.5 million members of the AFL-CIO standing firmly with